Welcome to my podcast. Today I'm going to talk about another case you could face in the clinical setting. So after we agreed, after you introduce yourself to the patient and double check their name and date of birth, you'll ask the patient, how can I help you? So it's a middle-aged man, a farmer who presented with some sort of extensive skin lesions that he noticed lately, the past few months, and he's otherwise fit and healthy. And those lesions, they presented only in his torso, and they quite separate significantly quite deal. And he stated notes that it catches in his clothing and it's quite itchy. And he's not a regular visitor to the doctor, and he just avoid them. So what could you think of those kind of presentation I just mentioned? And as I say, apart from that, he's fit and healthy. There's no past medical history. He's not taking any medication on a regular basis. He has no family history of the same alignment. And lifestyle-wise, he's keeping to the healthy lifestyle. He's eating sensibly, and he's not overweight, and he lives with his wife, and he's a moderator drinker. So when we hear a history like this, we need to think what could be the reason for the lesion to develop abruptly in that way, and grow in size and increase the number extensively within a short period of time. So the first thing we'll think of always, as we know, is malignancy. So what could have been the cause? So when we examine the patient, we just see a rough vegetative skin lesion, Blake-like, mostly brown. So the first thing you will think of is seborrheic keratosis. So when you see seborrheic keratosis extensively on the torso, this will imply a sign that we know, which is called lesser trill sign. And it's basically a rare skin disorder, but once it happens, it's most of the underlying presentation is malignancy of the GIT, which is adenocarcinoma. However, this doesn't imply that it won't affect other parts of the body, so for instance, breast, lymphoma, other organs like kidney, lung. And it has been also found with certain benign neoplasm as well, and certain infection like HIV, human papillomavirus, leprosy, COVID-19, and also in pregnancy. The trigger or the actual pathogenesis is not yet known. However, it has been stated it could be tumor-associated or inflammatory cytokine or other growth factor linked to the underlying triggers for this kind of skin lesion manifestation. And the main presentation is remarkable and knowing pruritus. And also you could find a sign or symptom of malignant acanthosis nigricans, which is another velvety thickened skin lesion and the folds on the breast, armpit, crura, neck. And it's common presentation anyway, and sometimes it's just the constitution of the patient and can be associated also with excessive weight or obesity. So in this kind of cases, you need to think thoroughly what you can do after ruling out some sign symptom. If you have something in mind like GIT, you will ask about sign symptom of malignancy. So for instance, if there is any change in the bowel habit, or if there is any blood or bleeding from the back passage, or there is history of alternate probably constipation with diarrhea or anorexia, weight loss, lumps felt in the tummy, all those sort of things, and the lifestyle and the food habit, all of that you need to ask. Just prop around, and then you will think about investigation to rule out the primary. And of course, once the primary is treated, this could resolute some of the manifestation by 50%. And if the symptom is kind of persistent or stubborn, of course, you'll think about antibiotics measures. And if that doesn't work, you'll think about ablative approaches, as we all know what can be done in cases of seborrheic keratosis. So this is a case can present anytime, which shouldn't be missed. And I hope by that I just cover the main points associated with this in order to tackle those kind of cases. And if you have any feedback or you come across such cases, you can let me know by writing down in the comments. Thank you.